Hi, everyone. I'm Dr. Tiffany Mullen. I'm the CEO and co-founder of Vital Health, and I'm also an integrative and functional medicine physician here. I'm going to be talking about one of my favorite topics, gut health, and how it shapes overall health. In functional medicine, we like to talk about how the gut is the center of the universe, and I kind of think that's true after doing this for such a long time. But hopefully you'll learn some interesting things about your gut and how you can influence your gut health and shape your overall health. So, what is the gut exactly? We hear people talk about the gut, and what it is exactly is all of this. The stomach, obviously, the small intestine and colon, all of which are sort of our digestion and absorption parts of our gut. But there's also important parts of the gut, such as the liver and gallbladder, that help us digest, and the pancreas, which is an important source of digestive enzymes. So all of these organs collectively are what we refer to as the gut. And people can have issues with gut health at any point along this. And I didn't mention the esophagus, but obviously that's another area. Anywhere from the mouth all the way to the anus, people can have issues with gut health. And that is part of what we need to unpack when we're talking about treating the gut. So what does the gut do exactly? It actually has three broad purposes. Broad. I'm not talking about great detail here, but broadly, obviously digestion and absorption of our food and our water, etc., occurs in the gut. That's kind of an obvious one. We also have an incredible amount of immune protection that happens in the gut, and that makes sense. If you think about it, we are interfacing with our environment through the gut, and that is an important place where we learn, our bodies learn what is self and what is not self. So that whole interface of the gut-associated lymphoid tissue, or GALT, that important immune function of the gut, where some things are being called in and some things are being left out, that is a key function of the gut. And then also hormone and neurotransmitter production can happen at the level of the gut, which I think surprises a lot of people. We do make hormones in our gut, and we actually also make neurotransmitters. In fact, 95% of serotonin in our body is made in the gut. So having those functions be a part of how we function basically is critical. So if somebody has issues with hormone imbalance or has depression or anxiety or other mental health issues, sometimes we need to be looking in the gut for the root cause. Now, how does the gut impact health? Well, obviously, if digestion and absorption is not happening well, we get malabsorption. We have nutritional deficiencies, vitamin deficiencies, protein deficiency, fat malabsorption, all kinds of problems where we're just not moving those nutrients into the body appropriately. Obviously, if immune protection is impacted, we have inflammation. We have this ongoing inflammation that it can occur at the level of the gut lining that both impacts digestion and absorption, but also impacts the body at large as it drives inflammation throughout the body. And as I mentioned earlier, having hormone and neurotransmitter production be impacted can lead to hormone imbalances as well as mental health problems as a source of, or as a cause of why those things are happening when the gut is impacted. How do we identify problems with the gut? I think obviously we take a big history. We look at some of the triggers and mediators that might be happening as a patient describes their symptom to us. But we like to learn about the deep functioning of the gut, and we do that through a digestive analysis. There are several that we do. This one happens to be a stool-based kit that is done at home in the comfort of home. And this is just one piece of it. I'm going to show you a few pieces of this test. But the first thing we want to look at is digestion and inflammation. So it's a busy slide, and there's a lot of numbers on here. But generally what we're looking at is how well does our body break down our food, our proteins, our fats, our carbohydrates, and bring them in? And then are there any markers of inflammation? And I have one circled here in red. That's fecal secretory IgA. That is an inflammatory marker typically associated with food sensitivities, but not always. And then we can look at the metabolic health of our colon cells as well. In this particular individual, at the very bottom, lots of imbalances there, which kind of tells us there may be something going on that's getting in the way of the health of the colon. So lots of really important information from this digestion and inflammation panel. We can also look at microbiome. So the microbiome is collectively the healthy bacteria, viruses, and fungi, yes, viruses and fungi too, that occupy all of the openings of our bodies, our mouths, our ears, our throats, our esophagus, our colon, vagina, all parts of us, even our skin, that we live in balance with and harmony with and absolutely need to survive. So the microbiome, the thing about the microbiome with respect to GI health is the more diverse that microbiome is, the more different types of families of bacteria we have, the healthier our gut is. And so you can see when we look at the individual, this individual's microbiome, they are quite non-diverse. They're in that red zone where they should be in that upper left-hand corner in the green zone. And that kind of just gives us a snapshot of how healthy is this person's microbiome. In this particular test, we also can dig into individual bacteria in the microbiome and see where there might be deficiencies or excesses. We can also look for infection, and again, stool test at home. We can find certain bacteria that are thriving in the gut that shouldn't be there in high amounts, like this one, Citrobacter. I have it circled in red there. It's high. This particular individual's stool is being impacted by this potential pathogen, and sometimes taking that pathogen out can allow the microbiome to thrive and can drastically improve the health of the GI tract overall. We can also look for yeast. I think I hear a lot of people talk about candida overgrowth or candidal overgrowth of the gut. That can be measured. That's that mycology culture at the bottom. If you don't have yeast, you don't have yeast. We can pick it up in the stool. I think it's a really important way to evaluate whether that's true for you or not. I'd like to focus on how we heal the gut, and this is a very simple idea. But it involves what we call the 4 R's. That is removing things, replacing, re-inoculating, and repairing. So when we remove, what we're removing are things that we're sensitive to, food sensitivities, dairy, gluten, eggs, soy, certain things that we can test for and are bothering the gut, causing it to have problems, causing it to be leaky, causing inflammation to happen. We also want to remove infections if we identify them. Such as the previous slide that I showed you where there was a Citrobacter infection, removing that. Replacing, if we find that there is a digestive difficulty, the person is not absorbing well, we can add digestive enzymes. We can also add betaine HCl, a very, very weak form of acid, to help the stomach improve its ability to break down food in the first part of digestion. We can re-inoculate by providing the gut with probiotics or prebiotics in the form of either supplements or foods. Foods like kimchi, kefir, kombucha, anything pickled. These are really rich forms of probiotics. Prebiotics are found in high fiber foods, and particularly in things like Jerusalem artichokes, bananas, etc. Really, really important to feed our healthy bacteria, make them happy. And then repair, if there is leaky gut, if there are gut motility issues, such as chronic constipation, addressing those and repairing those are really critical to getting the gut back into function. So when I hear from patients that they've been diagnosed with irritable bowel syndrome, whether it's the diarrhea type or the constipation type, I think of that as just a label. I think of the need to further dig in and find out why one has an irritable gut. That is an important thing. We don't want to just cover the symptoms. We want to improve the health of the gut because the health of the gut is so incredibly important to the health of the body. We need adequate nutrition. We need low inflammation. These are important parts that the gut can contribute to, but can also cause problems with it if not addressed. Thank you so much for your attention. I hope this was helpful for you. Please reach out to us if you want to learn more, www.vitalhealth.com. We're on social @YourVitalHealth. Thank you so much.